Hi, I'm here with Dr. Hanish Patel, who's a specialist for dry eye disease. And he's a great speaker for InMode. So let's talk to you. Dr. Patel, tell us, if you're buying an InMode, what do you start doing? What do you start right now? If you just bought an InMode, what should doctors do?
So three things, I think. You're going to start with your patient list.
Yep.
Okay, get a patient list together of all the patients you've seen in the last 1 month, 3 months, 6 months that have dry eye that you're wanting to treat. Reach out to them, get them on board, get them in. Second thing, get your staff in the game, right?
Yes.
Talk to your staff, make sure your staff understand why you're doing these treatments, what you guys are offering, that you are going to be at the cutting edge of dry eye management.
Yep.
And then the third thing is do it, right? Get that machine on and
Yep.
get using it.
Exactly. And do you find that optometrists have a tough time communicating about dry eyes to patients sometimes?
Yeah, I think you have to shift your language and your mode of practice when it comes to the conversation of dry eye.
Yeah.
For a lot of times we've been running away from dry eye, and because we didn't have all these amazing tools to treat these patients.
Yes.
And now you're finding yourself running to dry eye and having that conversation and making sure they understand that dry eye is something they should manage.
Right. I love that. And then what happens after the patients get their treatment? How do they feel? What's the response been to patients?
I mean, they feel great. I mean, it's the first time some of these patients have had relief, right? Instead of just putting in drops every hour or more. I mean, sometimes these patients come in, they're really in bad shape. And then there's some patients that are actually kind of mild symptoms, but once they feel better, they really understand, like, oh, maybe I was more symptomatic than I thought. They just dealt with it, right? So they feel really good. Those are going to be patients for life. They will come in for top-up treatments when they start to feel things are going downhill again.
Yeah.
You know, they understand it's a chronic condition. Make sure they get that, right? It's not a quick fix, right?
Yes.
But it's a management program that you're gonna do.
That's right. And then we're here at this conference for myopia, of course, and myopia is a big epidemic, but I think dry eyes is probably a bigger one in some sense, isn't it?
I think so. I mean, basically everyone is your patient.
Everyone's on these screens.
Everyone's on screens. There's no one that doesn't sit on screens all the time.
Right.
We're spending an insane amount of time on screens,
Yeah.
and people are really, really dry. We're seeing a huge amount of dry eye patients now.
Yeah.
I mean, it's just skyrocketed in the last 4 or 5 years.
Yeah.
I think it's really.
So it seems like it's a big opportunity for optometrists who are looking to get into dry eye disease because the patients are there.
Yes, the patients are in your chair already. Just identify them and talk to them, get them educated, right? Whether it's yourself, whether it's using something like Hoot to educate the patient so they understand the problem and then solve it.
Yes. Excellent. Dr. Patel, thank you so much for your time
You're
and your
welcome.
wisdom. Hopefully you enjoyed it. Dr. Hanish Patel is a pro. If you have got an InMode, you need to talk to Dr. Patel. If you're thinking about buying one, you need to talk to him because he's going to give you a great plan. So this is Bob Migliani with Dr. Patel. Nice
Thank
to
you, Bob.
see you.
Yeah,
Thank you
good
so
to see you
much.
too.
Thank you so much.
Thank you.
Thank you.